Hi and Assalamualaikum everyone. On behalf of Hospitals Beyond Boundaries, we would like to thank all our dedicated donors, healthcare staff and volunteers. You guys are the reason we could keep moving forward and help more of those in need. And it has been 9 years since the beginning of Hospitals Beyond Boundaries, and I'm excited and looking forward to have more programs after this, and we could help more people. And please guys, remember, stay safe during this pandemic. Always wear your mask, keep physical distancing, and please practice hand hygiene all the time. Thank you very much.
Assalamualaikum warahmatullahi wabarakatuh, and very good day. Greetings to everyone. Firstly, on behalf of the organizer for this webinar entitled Diverse Outlook, COVID-19 Pandemic Response in Conflict Zones, I would like to thank you and welcome everyone who has taken the time to join us today on Zoom and also on Facebook Live. This second COVID-19 international webinar is organized by Hospital Beyond Boundaries in collaboration with International Federation of Medical Students Association Gaza. We assure you that the team behind this, they have been working tirelessly to make this webinar, which will hopefully benefit us all in our mission to share, disseminate knowledge and information regarding this unprecedented global pandemic of modern times. We need to realize actually that we are all in this together, despite of physical location. And the sharing of knowledge, both in terms of the success stories and also our shortcomings, is crucial in order to beat this pandemic. Therefore, it is a very great pleasure to welcome our esteemed speakers today who are working in medical and healthcare field to share their experiences in working in the COVID-19 pandemic in conflict setting. So it is different from what we used to. So first of all, I would like to welcome Dr. Ihlas Altinci, a sexual and reproductive health advisor for Care International. She has working experience as a family doctor in Syria and currently based in Turkey, where she works with different international organizations for projects in Syria. Hello, Dr. Ihlas. Right, we are glad to have you here. Also welcome to Ms. Manar Marzouk, a global health researcher for COVID-19 International Modeling Consortium at the University of Oxford. She is involved in projects related to COVID-19 and her research experiences extends to fields such as health policy and health system. So hello, Ms. Manar, thank you for your time to be here. Also a warm welcome to Dr. Mohammad Rayya, health consultant for multiple organizations, local and international in Palestine. He has years of experience in public health. So hello, doctor. It's nice to have you here. And last but not least, welcome to Dr. Walid Daoud, former director of chest department, Shifa Hospital in Gaza. He has 30 years working experience as a medical doctor and was appointed as a tuberculosis expert by WHO. Thank you, doctor, for your commitment to be with us. We are truly honored to have all of you here with us today. Before we go further with round 1 and round 2, so we're going to have 2 rounds where I will be asking each speaker a question. I do have some housekeeping matters to share. First of all, this webinar is recorded, so it will be available for viewing on the Hospital Beyond Boundaries website and also Facebook page. The link will also be shared on our social media platform, so do visit us there. Secondly, don't forget to support us by liking, sharing, and following us on our social media platform. Presence that will help us to promote our initiative better. We will also have a question and answer session at the end, so feel free to send in your questions either in the those in Zoom. You can leave it in the chat section or on Facebook Live on comment section, or you can contact one of the team members that you have. So before we proceed with our webinar today, I would like to invite Ms. Asmah Shahidan, the Secretary General of Hospital Beyond Boundaries, to give her introduction. Please welcome.
Hi, thank you, Mr. Nasir. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning and evening to everyone, everywhere you are. It is my honor to welcome all participants from across the globe to our second COVID-19 international webinar entitled Diverse Outlook COVID-19 Pandemic Response in Conflict Zones. First, I would like to extend my very warm welcome and thank our distinguished speaker from across the world, mashallah, from Turkey, Syria, and Palestine to take time out of their busy schedules with us to share their precious experiences and drops of wisdom. So Hospitals Beyond Boundaries, as known as HBB, was born 9 years ago as a response of conflict, famine, and disasters in an effort to build back society after these periods of turbulence have subsided or a bit. Two young medics in that time, Dr. Lutfi and Dr. Hanan, noted that often too little attention was paid to the reconstruction of these traumatized communities, while many NGOs and individuals are recognized for providing aid at the peak of troubles. While these two, looking into more long-term and sustainable solutions, they began to work with several Cambodian NGOs, and soon it became clear that there was a disparity in basic healthcare in countries close to home, which is Cambodia. They needed hospitals. Dr. Lutfi and Dr. Hanan were looking a way to give back. Hence, a lifetime partnership was born, and so was the HBB team. Our underlying focus behind HBB is continued to be to provide affordable healthcare services to aid and help the local community in elevating poverty. HBB was registered under the Registrar of Society on the 22nd of May 2012 under the Malaysian Societies Act 1966. So we aim to build a hospital and healthcare facilities where they are needed most. So we achieve our mission through sustainable healthcare efforts in the form of social health enterprise. Alhamdulillah, we have our first healthcare facility in Phnom Penh, Cambodia. As we speak, HBB has treated 8,000 or more patients with a variety of complaints ranging from our outpatient department clinic, circumcision department, hernia repair, as well as other services. So we strive to begin operating more HBB healthcare facilities in different locations around the world in the future, inshallah. So the fight of COVID-19 pandemic is far from over. So this pandemic has shifted and challenged us as a non-profit organization in terms of operating. We wish to continue contributing awareness and knowledge to the local and global citizens in the pandemic. So we wanted to ensure that we present topics that are engaging, relevant, and informative to everyone in different regions. So thus, we bring to you our second International COVID-19 webinar led by our HBB Chief Operating Officer, Shafiq. So through this webinar, we have been privileged to collaborate with the International Federation of Medical Student Association, Ifmsa Gaza. So I would like to express my gratitude to Mr. Mahmoud Abu Samra, the President of Ifmsa Gaza, and together with all the members of Ifmsa Gaza with their effort in making this webinar into success. So we are thankful and appreciate the hard work that you have contributed towards this discussion today. So Ifmsa Gaza journey officially began with the accreditation as a members of Ifmsa in 2006. There are more than 900 students from Palestine Faculty of Medicine at Al-Azhar University, Gaza, and they represent the only branch of the Federation in the Gaza Strip. They play an important role for local implementation for global health priorities and the United Nations Sustainable Development Goals as they try to elevate, to raise the level of health awareness for the community throughout medical students at Al-Azhar University, especially regarding information and awareness on the COVID-19. to the Vice President of Ifmsa, Mr. Mohammad will explain more about the rules and efforts towards the COVID-19 throughout the COVID-19 pandemic in the upcoming segment of the webinar. So I think that is all from me. I really hope and pray that this session will be beneficial and initiate more fruitful discussion among us and lead us closer to a global solution to overcome this pandemic. I now pass back the floor to Mr. Nazir to continue to moderate the session. Thank you.
Thank you to Ms. Asma for the introduction. For those who have just tuned in, welcome to the webinar, Diverse Outlook, COVID-19 Pandemic Response in Conflict Zones, organized by Hospital Beyond Boundaries in collaboration with International Federation of Medical Students Association, Gaza. So we have just been introduced to Hospital Beyond Boundaries by the Secretary General, Ms. Asma, and it's truly an inspiring story. Let us help and support Hospital Beyond Boundaries in ensuring that the success of its initiative is something that's tangible. Please do again remind you to visit and like and follow the Hospital Beyond Boundaries website and also Facebook page and other media platforms to get to know more about the initiative. Right, so now we can proceed to our first panel discussion for today for our first speaker. And the way we organize this, we're gonna have two rounds, round one and round two. I will ask one question each, and all speakers, each speaker is given 8 minutes to respond. So without further ado, my first question I would like to direct to Dr. Ihlas Altinci. You're based in Turkey and as a project manager for sexual and reproductive health project in Syria. What is the current situation in Syria and the main obstacles that you face in managing different health projects there in Syria in this pandemic climate?
Okay. Thank you very much. And thanks also for Hospitals Beyond Boundaries to invite me to such an important event and be part of such a brilliant panel. It's my honor to be here and talk to all of you. Basically, as you said, originally I'm a Syrian. I'm located in Turkey and supporting some health facilities inside Syria. As you know, it's up till now, it's 10 years into the Syrian crisis, and it makes it very difficult to confront the COVID pandemic. I mean, Syria is in an extremely poor position to confront the pandemic. I mean, big countries, solid health systems couldn't do it. So imagine what the situation is inside Syria. And of course, this puts Syrians at a very high risks, different risks. If we speak a bit about the country's health system, we see that, I mean, the entire health system, the energy infrastructure, water infrastructure, sanitation, and so on, have been largely destroyed because of the long years of fighting. For hospitals, clinics, and health workers, there are major risks that they are facing because, I mean, they were and they are still deliberately targeted. And even for the hospitals and clinics that are still able to be operational, they lack equipment, they lack trained personnel, they lack medications, consumables, and medical supplies in general. Speaking of, I mean, when was the first case of COVID-19 registered in Northwest Syria? That happened in July 10th, 2020. And if we look at the numbers now, after almost half a year of the spread of the pandemic in Northwest Syria, we see that according to the numbers issued by the health cluster at Gaziantep level hub, the numbers of yesterday, it was 21,000 almost confirmed cases of COVID-19. And it is, I mean, there were 380 deaths related to COVID. As for the numbers registers in the Syrian government-controlled areas, we see that it's about 14,000, sorry, and with only less than 1,000 deaths that are related to COVID that they were registered. Of course, I mean, we can imagine that those numbers are unlikely to be reliable indicators of the pandemic spread in Syria. Rather, they reflect the low level of overall testing, the difficulties of confronting the pandemic, and the fallout in the war torn and fragmented country, as you know. So basically, I mean, the risk of being affected by COVID-19 is highest for some 6 million internally displaced persons that exist in the country. And most of these vulnerable groups live in cramped conditions. I mean, where you cannot apply, the rules of social distancing. They lack access to health services. Hygienic conditions are catastrophic. So, I mean, in some cases, they don't even have access to clean water. So we cannot speak, about applying the rules of prevention of COVID-19, which are social distancing. I mean, let's say, even wearing masks is sometimes difficult because if I would, be I mean, inside Syria and I need to, think about should I buy a mask and use it or should I buy some bread for my family, I might, prefer the bread over the mask. I mean, if we look at the measures that were adopted by, the local health actors or authorities, if I can call them, to contain the spread of the virus and, prepare for dealing with infections. Also, I mean, those actions and, let's say, attempts to control the situation were undermined by the conflict dynamics. So, I mean, they tried, let's say, in order to prevent the spread of the pandemic, to implement some partial, closure of borders, to, enforce some mobility restrictions, curfews, or I don't know, suspension of non-essential economic activities. But yet, I mean, people, if they don't work, they will not eat, and it wouldn't be, and it wasn't, really possible to implement those curfews and, restriction of movement. Unfortunately, schools and universities were closed. And this, let's say, would make even the situation for students even worse because they initially they had no such great access to education anyway, and now everything, let's say, is stopped. If we speak, about the work I'm personally doing related to sexual and reproductive health and the challenges that we are facing, while providing those services, in times of COVID. We see that, COVID-19 impacted the protection, sexual and reproductive health, and general health activities significantly. I mean, because specifically for protection and SRH, they might, and they contain a lot of activities that focus on delivering individual and group consultations, like for PSS, like for family planning, like for awareness raising sessions, like for general protection. So the impact, was very clearly reflected in the decreased number of specifically women and girls able to attend those sessions, or the number of beneficiaries we are able to reach. And of course, gradually with the increase in COVID-19 number of cases in Northwest Syria, because of the restrictions, because of the curfews, because of, the movement restrictions and so on that were imposed by the authorities, we saw that there was an increasing number of child abuse, gender-based violence, domestic violence, physical, verbal, sexual abuses and assaults. And yet, and this is globally, and this happened globally. It's not, let's say, something that is specific to the Syrian situation. And with the difficulties in reaching, the survivors or the beneficiaries, it's even worse. If I can say some final words about the health professionals situation. I mean, for the Syrian or northwest side of Syria, the first case registered in the northwest, it was in a doctor that was traveling between Turkey and Syria. So let's say that doctors in general were hit the hardest by the pandemic. Of course, all health professionals, nurses, midwives, technicians working in hospitals and so on. And it created some kind, you know, of stigma. It created some kind of, frictions between the community and the staff. And considering that already the number of staff is very few, already we have shortages in health staff in general, not only in doctors, it even made it worse. So in some cases, because I mean, 1/3 or I don't know, big number of health staff working in a specific facility were infected with the COVID-19, facility had to stop. The outpatient clinics had to be closed. The number received inside the hospital has to be minimal, and still only urgent cases are received inside the hospital or the facility in general. And this, let's say that is making the situation for the population and the staff even harder and harder. Access to personal protection equipment also was hard. So, seeing all that situation, it makes it, difficult for health staff to provide the services. Yet it's continuing. Thank God it didn't, alhamdulillah, didn't stop. Yet the implications and the challenges are very big. I could give you, some positive examples also that happened. It's not only that everything is negative or impossible to be handled. So there were some, let's say, initiatives or methods, different methods used specifically to deliver protection services, PSS services, where WhatsApp groups were created. So, I don't know, counseling or some kind of consultation can be provided to beneficiaries. But again, it was a bit difficult considering that the internet is not that, available. The women and girls we target might not have a phone or a mobile phone. Even if they have it, they are not allowed to be, in different groups. Even if they are, they have the internet, they have the mobile and can access a WhatsApp group or something, it's the nature of the issues to be discussed. They cannot be discussed publicly. They cannot, a group of, God knows, 10, 50, 100 different persons, you cannot, sometimes it's difficult and so on.
So there are many challenges. So there are many challenges happening in Syria from this what I've shared just now on many levels because you're approaching your time just for this interruption. So you have many challenges and at many levels whereby you have the basic necessities, services is not there, and you're lacking of manpower, you're lack of equipment, hence things are trickling down, and you also have this existential dilemma whereby should you spend the money to buy food or should you spend money for something that you're going to throw away anyway. So thank you for those sharing just now. And now I'm coming to Ms. Manar Marzouk. And I've been told that you are part of the team that prepared the COVID-19 modeling mitigation measures to curb the spread of COVID-19 in the northwest of Syria and the northeast of Syria. Can you share with us what's that all about?
Thank you very much for the invitation. Am I allowed to share the screen? I want to share the presentation. Can you allow me to do this, please? So I want to thank you very much for inviting me for this really lovely talk. And I think I'm still not able to share screen. Okay. So yeah, I think I want like to, my presentation will follow on Dr. Ihlas' discussion. And as she drew on, like the health system in Syria is fragmented. I mean, we have like now around four health systems. I mean, Northwest, Northeast, and the government controlled area, and then the Turkish controlled area. So I think in my short, like couple of slides, I want to focus on my work on the COVID-19 modeling in northwest of Syria, as you see, like in the below picture, and the above picture is the northwest Syria, northeast, and I think why modeling? I mean, maybe the question. I mean, since the start of the announcement of COVID-19 as pandemic by WHO, we were very concerned, as Dr. Ihlas said, like about the impact of COVID-19 on displaced population, and where people there living in crowdedness, they lack basic access to water and health and care and sanitation. And as you see, like, I mean, in just brief, like about the population in the northeast of Syria, like 2.6 million, we're talking about 600,000 are displaced. And in the northwest, 4.2 million, we're talking about half of the population is displaced. So the COVID-19 has been delayed to arrive to Syria because for many reasons we have like disconnected from the outward. And the first case was announced in July. And I think at the moment, still like the number of cases are, I mean, relatively high, but the death is quite low compared in relative to other countries. But then we're talking about a place where the health system capacity is very low. I mean, we're talking about ventilators for 2.4 million people. We're talking only 83 ventilators. And then the other thing is like the age structure of population. So if we look at the this photo, like the Syrian population is skewed toward younger demographic. Like we have only 2.5% of population is under 65 years old. Nevertheless, I think when we're talking about COVID, it's not only like the age of population. We still don't know much about the disease. We still don't know how like the living conditions, the hospital capacity, access to wash, how all of this will impact the transmission of the disease. So what we did is like in April, in May 2020, I established a COVID-19 modeling group in the northwest of Syria. This includes 6 local health experts from local NGOs. There's NGO UDR, surveillance organizations such as EWARN, and frontline health care providers. And then later on, also we established a team in the Northeast in November 2020, including COVID-19 task force in the Northeast. So the method that we used is like age-structured CER, and then our method was developed by COVID-19 International Modeling Consortium, and then this is what established by the University of Oxford, including 45 countries at the moment, and we're spreading more. And I think there are experts from different epidemiological and modeler background. And our model we customized by the common modeling team in the Northwest and Northeast, like it's contextualized to the need of policymakers in this area. And then the working framework that we use. So we tried we have many concepts. First, like we tried to promote that COVID-19 modeling is a common ground for different conflicting parties. So we have Northwest and Northeast. I mean, there is not many programs working in the same areas, covering both conflicting areas. So it was really hard for us to make sure that this modeling keeps a neutral, like as a scientific, and work in different areas in Syria. And second thing we are using, as you see in the photo below, we use participatory approach. So we continuing collaboration between policymakers. So the node in the gray node is the people who developed the model, technical groups in the University of Oxford and the COMO consortium. And then the purple one is the team that we established in Syria, whether in Northwest or Northeast. So and then we have like the continuous collaboration with policymakers. I mean, as Ihlas was saying, it's important to know like what our interventions are like we are able to implement. So so they were helping us also like with hospitalization parameters, how we can adjust it and how can we make it better. And I think also like it was important for us, like this continuing knowledge sharing between different modeling teams in Syria and with other countries. Like we had like from the Como Consortium teams from Bangladesh, where we were able always like to exchange and build our capacity. I mean, just to end here, and then later on, maybe in the next session, I can talk maybe about the results, but just I want to say that why mathematical modeling is crucial in low middle income countries or complex settings. So first, I mean, it helps to support decision-making process by providing policymakers with evidence-based. They can weigh the cons and the pros for different mitigation measures. And this is very important when, for instance, like in Syria, like according to UNICEF, there are, I think, 2.1 million children, they are dropped from school during the conflict period. And then when we're talking about implementing a measure such as school closure, which is also like, it's helpful to mitigate the COVID-19, but then how to weigh what is like, whether like children, like education who drop school, or like the risk of COVID. And this is where the modeling is helpful, because we will able like to project, I mean, COVID-19 mitigation measures on COVID-19 cases and death, and then this gives tool and evidence for policymakers to use. And then the other thing also, like when we're talking about a context where the hospital capacity is functioning on half of its capacity, if not less. So projecting the impact of COVID-19 on hospital occupancy, how many ICU beds, for instance, and hospital beds will be required at the peak of pandemic in this area, projecting the number of ventilators required. So I think this is very important in the decision-making process, and this is where we are trying to work with our initiatives in the Northwest and Northeast. Thank you. So yeah, this is the main thing that we're doing at the moment.
Right, thank you, Ms. Manar, for that presentation. Basically, you're moving with evidence-based, based on data, to make decisions and help the Syrian government to decide the priorities to spend their resources. And my next question would go to Dr. Mohammad Abu Rayya. As a public health consultant, what are the challenges that Palestine face in responding to this COVID-19?
First of all, thank you for this invitation, and thanks for all the colleagues who have been attended and sharing this experience from Iraq, from Syria, from Malaysia, from different places. But we can say that we are sharing the same problem based on our crisis, and maybe a little bit different, the crisis in Palestine, because our crisis it's not a bit through, let me say, it's not a natural catastrophe. Our crisis is based on a human crisis, based on the occupation. Palestine and Gaza especially under occupation since a long time. We are under siege, more than 15 years since they started. The health systems in Gaza is fragmentation and having so much weakness in the system, based in different categories, such as the occupation and the border have been closed, shortage of equipment, shortage even so for training for the medical student to attend overseas training courses. And also the most important issue is the spare part, and to share our needs based on the need and demand in Gaza Strip. Let me say that Gaza Strip is more than 2 million persons living in the most high density place all over the world. We are challenging and having so much obstacles inside Gaza. This kind of obstacles and difficulties we are facing. We're trying to make some modules and trying to make some different ways. Maybe since we started the COVID-19 in Palestine in March, our governmental in the West Bank, they announced for the closure. So we are the first people maybe in this area who have been following the rules by the closures and to put the people under their home. Yes, we have so much difficulties in the bed, in the ICU. We're trying to usually to improve our health situation based on the donors. The problem in Gaza and Palestine is that we are stateless, so we cannot control ourselves. Whatever we can need, we should go through borders, and the borders unfortunately have been usually controlled from the occupational side. There are a lot of reasons, and in case that we need some equipment, sometimes they refuse it based on security issue, double used. We have a lot of problems for health system. During the COVID-19, as you know, and all my colleagues have been said, the COVID-19 have been coming suddenly for this war without any preparation. So we are also part of this war. We was not focusing in the COVID-19. We are not focusing in communicable and non-communicable disease. All our tasks in Palestine, especially in Gaza, we are focusing in casualty, in emergency, in war, because this is our life in Gaza City, to be honest. When the COVID-19 have been started in Palestine, and especially in Gaza in August 23rd, we put all the plans just to control the cases, and we was a little bit lucky because the border already we are under siege. So no, it's not easy for the people to go and to come through Gaza. So to give us a chance to prepare ourselves to control and to make the quarantine for the people who's coming and leaving Gaza City. The second issue was maybe the first maybe area we were making the quarantine and the isolation more than 21 days. All the people over the world, it was 14 days, but we're making more than 20 days just to make sure that there are no any personal defect or any below 1%, a problem that we cannot control, because as all of you know that again and again we are the most high density population all over the world. So in case in that time the pandemic had been started in Gaza to be like a catastrophe, will affect all our side in Palestine. COVID-19 have been we face it as all of the countries. A little bit we're having some problems for trying the cases, for the tracing the cases, for the investigation for the PCR. Usually our central laboratory have been stopped many times during last year because the shortage of equipment, shortage of kits for the PCR examination. We're trying to make an urgent appeal for the international committee, especially for WHO and the others NGOs to support our nation. Let me make it clear also that our population in Gaza, we're having the youth people is in the top of the pyramid of population. We are trying to control the most important issue belong to the COVID-19. We increase the capacity of the beds. We have only before the pandemic around 70 ICU beds only. We improve it for 100. Now it reached for 150 to 200 beds during this kind of pandemic. Our people have been affected by COVID-19, more than 50,000 persons. The death people from the COVID-19 around 500 cases at this moment, but we still, to be honest, scared about the situation because, as you know, still we don't receive any vaccination. The occupation, even so, playing a bad role, not following the Convention of Geneva to provide us by the vaccination, and still we are under this kind of occupation. COVID-19, and we're trying to focus in our home isolation based on the running cost. So we shift from the module of quarantine and isolation for the people inside the hotels and the hospitals and in the borders houses to the home isolation. This kind of home isolation becomes like most difficult side in Palestine, especially in Gaza, based on the high density population. In each 1 kilometer, there are around 5 to 1,000 persons living in this 1 kilometer square. So we're trying to create the modality for having a home isolation by providing them with medical equipment, food, kind of oxygen in case that they need mechanical ventilators, or case like some people who need pulse oximeters to check them with the NGOs, international NGOs support based on the needs on Gaza City. And we also trying to, it's not easy to make a distance between the people in Gaza. For example, if you talk about Jabalia camp is containing about 1,100 population in very small area. So it was on one of the most challenges which we are facing. We are trying to usually to make our modality based on the public awareness, to speak frankly and honest with our population to be safe inside and to increase the public awareness. We're trying to encourage the governmental to use the new social media for trying to raise up the issue, to put the people in the situation, to tell them what is the complication and the consequences of the COVID-19 in case that you have been affected. And also the most important issue is the patient who is in daily care use, such for a cancer patient who are suffering during the COVID-19, because majority of them are scared to leave Gaza to take the treatment in the West Bank or even so in our occupied land inside Palestine, because they're scared to be under isolation for 21 days. And this kind of worrying from them side, put them under a lot of pressure, and they delay their chemotherapy and radiotherapy. Other things also for the kidney failures patient, we are suffering from a lot of issues regarding to them due to of the occupancy, and during also for the overcrowding of the people in Gaza. We're having around 14 hospitals in Palestine. We're trying to put nowadays in each hospital a ward for a pandemic for the COVID-19. Before we were having one hospital in the south of Gaza, the European hospital, especially for the COVID-19. But today, because of the cases have been increased, and we are scared from the second wave, maybe to come in February or based on the winter. So we're trying to put and to open in each hospital from this 14 hospital in Gaza, one department and ward for the COVID-19 patient. Majority of our frontline doctors and physicians and all the health workers have been infected by COVID-19, and this was also one of the most difficult because we have a shortage in physician, we have a shortage in staff nurse based on the bad salaries which they are giving to them based on this kind of challenge, and they are facing the problem. And also, let me make it clear that the international community are supporting Palestine and in Gaza, but still we need more and more, because the most important issue nowadays is the vaccine. We will not wait until all our people to be infected. So we are trying to raise up this issue based on the Convention of Geneva that we are still under occupation, and we need more and more to have this kind of vaccination. And let me make it also clear that Palestine and Gaza are suffering. We are still in the dangerous zone. Nobody can finish this zone without all together from the international committee and the local committee because of the most important issue. The Palestinian and the refugees camp and the home isolated is one of the most obstacles and difficulties we are facing. We are trying doing our best, and we pray for God that we can succeed in this kind of duty from your perspective. Thank you.
Thank you, Dr. Mohammad Rayya, for the description of the challenges that you are facing in the context of Palestine itself. Then finally, my next question, I would like to know, Dr. Walid, as someone with 30 years of experience in the medical field, Dr. Mohammad Rayya described the situation of hospitals and whatnot. Can you share with us the challenges that you, as a frontline doctor, face in terms of fighting COVID-19 itself? Right, do you have Dr. Walid? Right, apparently Dr. Walid got disconnected with the webinar today. Just a bit to summarize what Dr. Mohammad Rayya has shared with us regarding there's a lack of basic things, as you can see in Syria and as well as in Palestine, whereby hospitals are lacking, you are lacking in terms of healthcare professionals. Whatever efforts that you want to make is limited due to the logistical constraints that you have with under siege. And I think you did mention a few about where the proactive approaches that the Palestine healthcare authorities have taken to make awareness in the international community. And also you've prepared hospitals, increase in number of hospitals, you've increased the ICU beds to 150 to cater for the next possible wave. So coming with that all information and from Dr. Rayya have shared, my question to Dr. Walid is, as someone in the front lines, what are the challenges that you face in terms of responding and working in this COVID-19 pandemic?
Bismillahirrahmanirrahim. I think you are hearing me and you are watching me now. Sorry, because there is cut of electricity, but now it's okay. First, I would like to welcome all of you and hospitals beyond boundaries and my colleagues. Today, I will speak on first on the lack of medical equipments and supply and impact on these challenges on our work in Palestine, particularly in Gaza. The Ministry of Health strategies as regard COVID-19 pandemic is to slow and stop transmission, provide optimal care for patients, and minimize the impact on the epidemic on health system, social services, and economic activities. The biggest problem for the Palestinian Authority is to control and stop the outbreak of the disease in different challenges. So we are facing different challenges, and although to date, vaccine is still not received. However, an array of drugs approved for COVID-19 are used for other indication and they are still non-specific. Treatment, so, is essentially supportive and symptomatic. When we are going to speak about challenges in Palestine as regard COVID-19, the general challenge is Israeli military and economic control. So no control over borders and not easy to passage of equipments and medications. The weak national resources as regard medical and financial, and many population high risk characteristics like crowded cities in Gaza and in Palestine in general, refugee camps, poverty, food insecurity, and physical crisis. The budget deficit also is an important challenge. Palestinian Authority is not able to cover the full salaries to the employees, including health workers, and there is insufficient fund to cover the scheduled government transfers to the most vulnerable population. And there is a great number of Palestinians expected to need government support due to economic impact of COVID-19. As you know, the Gaza Strip is already in a humanitarian and economic crisis. Population is overcrowded, undersupplies, and in high poverty and food insecurity, and ongoing closure of Gaza makes it impossible to freely mobilize health services. There is movement restriction and the closure of schools and university and the growing unemployment. Many families already live in poverty, and consequence of COVID-19 response measures have made it even harder for them to maintain their livelihood and income. Also, the Palestinian Ministry of Social Development estimates that at least 53,000 families have fallen into poverty in recent weeks due to loss of source and of income. The mandatory quarantine imposed by the Palestinian Authority to contain the virus, either home-based or at dedicated sites, has increased the risk, including domestic violence affecting women and children, mental illness, and psychological deterioration. Following the closure of education facilities in early March 2020, more than 1 million children need to continue distant learning and receive age-appropriate awareness-raising messages around COVID-19. In Palestine, not only elderly and old people suffering from hypertension, pulmonary and cardiovascular diseases, cancer, and diabetes are most vulnerable to the development of severe illnesses due to COVID-19, but also there are several other people were impacted by COVID-19 outbreak. These include about 1,000 patients in Gaza cannot be referred to specialized treatment outside Gaza due to crossing closure. Also, more than 9,000 patients awaiting elective surgeries in Gaza, 3,000 of them were urgent that are postponed. About 50,000 individuals seeking outpatient support. On the other hand, pregnant and lactating women and children who might not be able to receive essential health care. Palestinian refugees who live in one of the 19 overcrowded refugee camps, as well as Bedouin communities with inadequate living conditions, most importantly, access to safe water and sanitation. Palestinians who are placed in quarantine facilities that may not be adequately prepared. We can say that the pandemic in Palestine, particularly in Gaza, shows triple tragedies. Number one, the virus, the COVID-19 pandemic. Number two, tragedy is ongoing Israel control or politics. Number three, the intra-Palestinian divide, a tragedy, which is policies. So we are facing three parts of the triangle: tragedies, virus, Israeli control, Palestinian divide. We provide essential hygiene disinfectant material or for families, people at high risk of being affected also by COVID-19. Distribute cleaning and hygienic package to all schools in the country to prevent the spread of pandemic before schools reopen. Rehabilitate the schools used as quarantine centers before open to ensure that they are back to normal status. We must not forget the food support for most vulnerable households, including persons with disabilities, elderly, lactating, and pregnant women whose food security is directly affected by the virus outbreak. So I will not take long time. Measures with a focus on early testing of all suspected cases, isolation, and the treatment of confirmed cases. This is the policy. Also contact tracing and quarantine arrangement, and complemented by primary and secondary community-based health initiatives with emphasis on prevention and promotion effective protection measures like hand hygiene and physical distancing. The health workforce is the backbone of effective health response and require adequate technical support and protection. Therefore, it is important to mobilize further resources to provide adequate training of health staff on most important clinical case management protocols and infection prevention and control policies. So the Palestinian Authority recommend different strategies to be pursued, which include procurement of equipment and drugs, support quarantine facilities, enhance and rationalize laboratory testing, support case management of patients with COVID-19 who require hospital admission, and enhance risk communication and community engagement and maintain core health services.
Thank you, Dr. Walid.
The capacity to implement physical distancing and essential hygiene measures in conflict setting may provide unattainable humanitarian setting suffer from the damaged health system where they lack healthcare professional, medicines, and equipment. Thank you very much.
Thank you, Dr. Walid Daoud, for your description of the challenges that Palestine and Gaza in particular face in terms of fighting this COVID-19 with the lots of economic control that's lacking, whereby equipment and personnel. Right, so with the response from Dr. Walid just now marks the end of our round one question. And I've seen a few of you just joined in. If you've just joined in, welcome to the webinar, Diverse Outlook, COVID-19 Pandemic Response in Conflict Zones, organized by Hospital Beyond Boundaries in collaboration with International Federation of Medical Student Association Gaza. And we have just finished with our experts explaining the challenges that being facing in conflict zone in Syria and in Palestine. And to start off round two, I will come back to Dr. Ihlas. You've mentioned before, you've shared with us a few challenges, and you've mentioned a bit about how domestic violence and sexual and reproductive health. Can you elaborate more on that, please?
Okay, thank you very much. So basically, if we speak a bit about numbers, just for us to understand, the full picture and the spectrum of the needs. So we see that 30% of the affected population in the Northwest Syria require routine reproductive health services. If we speak about the estimated number of women and girls in reproductive age, it's about 1.1 million. Among those, we have almost 600,000 adolescent girls, 60,000 pregnant women, and over 8,000 women who need to give birth on a monthly basis. So basically, all those women and girls are in need of essential obstetric and maternal health care. Of course, it comes with newborn care, comes with antenatal care, natal care, treatment of sexually transmitted infections, and clinical management of rape. So as also I said in my first comment, and as you explained, you know, the impact of COVID-19 on women and girls cannot be disconnected from the crisis, Syrian crisis, cannot be, you know, disconnected from the displacement. So in addition or in above to all those, the pandemic, I mean, put very high tension over the health needs of the affected population. So basically, if we speak, for example, about the gender roles, about the indirect impact of the pandemic. I mean, women in general in Syria I mean, they work inside the house, specifically in rural regions, outside the house. So, I mean, the burden of care is very high on their shoulders. And of course, there's very limited, I mean, availability of livelihood opportunities, of income, of, you know, education opportunity and so on. And the lockdown and stay at home, it was even harder for women and girls. And as we said, domestic violence and so on. And what worries me, you know, above, you know, all those aspects that we have mentioned, that now if we look at, you know, nutrition, I mean, previously in Syria, we never had malnutrition. It was very few cases. Now we see that it is spread between children under 5, in addition to pregnant and lactating women. So this is, you know, a very important issue that we should be looking after. Also, you know, I mean, the issues of sexual exploitation, I don't know, child marriage, or, you know, sexual abuse, or, you know, sexual services in order to receive aid and so on. Those are also very alarming issues that we should be taking into consideration and, I mean, do something about it. I mean, I was very worried to see some reports, specifically, you know, after the beginning of the pandemic, that we're speaking about, you know, parents taking their very small children. So we are talking about 11 or 12, 13 years old girls, children, taken to the doctors, midwives, so they can have their puberty early, so they can put into marriage. Because families cannot, you know, sustain all that number of children. I think it would be better for the, you know, honor and protection of the girl to be married off at a very low age. She would be from her opportunities in getting an education, and consequently in the future she wouldn't be working in a decent job because she doesn't have the skills and the knowledge in order to get a decent job. So the economic situation, I mean, and the displacement and the crisis all in all, and adding to that, the pandemic put, I mean, great challenges over the shoulders of the most vulnerable, you know, members of the Syrian community, which are women and girls and children. Basically, another, let's say, challenge is having a constant supply of you know, medical consumables, drugs, and as my colleague Manar said, I mean, the number of ventilators is very few, and it's not appropriate at all for the huge number of patients. The number of ICU beds, again, it's very small. It's almost always full now. The constraints are very big. The border gates where those supplies can cross is only one, coming from Turkey to Syria. And of course, I mean, at Gaziantep level, we have the health cluster, we have the WHO. They try their best, you know, to respond to those needs. There is a task force formed where you know, all the efforts, I mean, guidelines, SOPs are, you know, coordinated, disseminated. Yet, I mean, the situation is a bit not that, you know. For the Syrian population, and of course I'm one of them, I mean, I've been talking to the field many times, and they tell me, you know, you are asking for the impossible. We cannot just sit at home and, you know, have the luxury you are having, because I'm working from home since a year now. So we need to go out and work, and this, you know, we were subject to all kinds of risks, shelling, attacks, chemical attacks, and everything. So this tiny virus is nothing for us. We can live with it. It's more, you know, merciful than other issues or risks we were subject to. So basically, this is an overview for this sexual and reproductive health situation I can give you. Thank you.
Right. Thank you, Dr. Ihlas, for your input. The challenges on sexual and reproductive health does not occur here, but the challenges extends, the impact is extending to the future as well, in terms of the early marriages, whereby no lack of education, and that will impact their future as well. Right, now coming to Ms. Manar. You've shared quite a very interesting thing about modeling. And as a global health researcher, can you share with us the unique challenges that you've faced while you're working on this in Syria?
Yeah, thank you very much. I'm trying to, yeah, can you see my screen?
Yes.
Yeah, just a second, sorry to put it on the, so yeah, I think just like very quickly, I want to talk about our example, give example for our modeling in the Northeast, and talk through the challenges that we faced with this. So in the Northeast, we did like 4 scenarios for COVID-19 interventions. One, like the current situation, like if we do nothing, and like what will happen, what will be the impact of COVID-19 on hospital occupancy, on cases and death. And then the second scenario is if we impose a lockdown for 2 weeks. The third is putting a lockdown for 2 weeks, and then followed by 8 weeks of 4 moderate non-pharmaceutical interventions, such as school closure, hand washing, face masks. And then the fourth scenario is releasing all mitigation measures, that even the current mitigation measures, if like we do nothing, and then we just wait to see. And the last scenario is like a continuous of 3 months of moderate interventions. And then, as I mentioned, we implement 6 non-pharmaceutical interventions, including international travel bans, school closure, hand washing, face masks, social distancing, and working from home. And just we wanted to help policymakers to see what will be the impact. And then just summary of findings. I mean, I think it's important to see like the, so in total, like the current situation without doing any mitigation measures is predicted to result in around 3,000 COVID-19 attributable deaths and 20,000 severe cases within 3 months, which this would be increasing the burden on already exhausted health system. Whereas scenario 4, releasing all mitigation measures, is expected to increase COVID-19 death by only 10%, more than the current situation. And whereas scenario 3 and 5, which is like a lockdown for 15 days and then 2 months of moderate interventions, is expected to result in the decrease of infection percentage from 46% to 38 and 39 respectively. So what we conclude, I mean, here, like just also like we see like the epi curve, how it's changing with each scenarios. I mean, yes, I think imposing some interventions, moderate level, is delaying the peak, which is important, like for the preparedness for hospital to be prepared. Flattening the curve is important in this setting when we're talking about limited hospital capacity. The same here, like the prediction for hospital beds occupancy, that the scenario 2, lockdown for 2 weeks, and also like lockdown with 2 months, is like we will get us below the threshold for the health system occupancy, the hospital beds requirement. So but then I think what was Dr. Walid is talking about is very important, because what's the impact of this mitigation measures, and as policymakers, how we can make this tough decision? Because I don't think we should copy like the same mitigation measures used in Western countries, in high-income countries. It's weird. I think we have different contexts, and I think our priorities should be different. So I think this poster developed by Como Consortium, and I really love it because I think it shows the balance. I think, so with high-income countries, I think the priorities are different. I mean, in Syria, we're between middle income and like emergency conflict setting. So I think we need to be very careful to balance between how many cases we have, how many deaths this will result, the COVID-19, and then how much of the capacity of our health system do we need? Like our priority is to flatten the curve, because like we have like, let's say like, I mean, we will need to think about non-COVID-19 patients in addition to COVID-19 patients, or we are in a situation where there is like a low number of cases, and then we need only to think of minimal combination of interventions feasible to avoid interruption of standard health services. I mean, I think we need to be careful because, and at the same time, we need to think about the impact of each intervention. Like for instance, when we're talking about some interventions like hand washing, face masks, I mean, those hand washing, they won't have like, they will have the opposite. They'll have like positive unintended consequences on other infectious diseases. Whereas, I mean, some interventions like school closure, like social distancing, we don't know that they get the impact on sexual and reproductive health, on domestic violence. I was working on a study in COVID-19 impact on sexual and reproductive health in Asia. So I think we still don't know, I mean, what's the impact on mental health of people. So we need to be very careful in weighing this balance in decision making. And I want to also like highlight some of the particular challenges that I think related to the Northwest context and Northeast. One is the fragmentation of the health governance. So, I mean, COVID-19 modeling in Syria was a great lens for health system and to understand the health system function. So the fragmentation was very obvious from early discussion even about our parameters for the model when we wanted to think of scenarios and non-pharmaceutical interventions that could be useful. So we created the map for key decision makers in the area, and we ended up with over 10 decision makers with conflicting priorities. So how you implement a measure or mitigation measures if you have that much conflicting priorities? The other thing is we noticed is this empowerment of local authority. So when we started presenting our findings for local health providers, and then they were always referring us to the external donors, bilateral donors, because they didn't feel they have the power to implement any measure without approval from external donor. And then the third thing is the prioritization of no-cost interventions. I mean, what we notice always, I mean, the first thing that policymakers, they're asking us about, oh, can we close the schools? I mean, because I think there is no interest in investing in other maybe things like improving the wash. I mean, there are lots of things happening, but still, I mean, the focus should not be maybe on the school closure, which will have like harmful impact maybe on children, I think. But then because of the economic crisis, so I think the policymaker is focusing on this. The last thing is the data management. I think we're still struggling as well, because this is related to how the registry in Syria had long history of like how the death is registered. We cannot calculate excess mortality because there is no credibility of the data over the past years. Even in the hospital, how the death is registered, how we identify this as COVID, non-COVID. I think there is still lots of challenges. There is lots of work is being done by some, institutions, HIS in the Northwest. There are EWORM, but I think there is a lot still to be done. Thank you very much.
Right.
So this is mainly I'm happy to answer any questions.
Right. Thank you, Ms. Manar, for your input just now. And I mean, it is very interesting to know that the mitigation measures for different countries shouldn't be the same. And that tallies a lot with my next question to Dr. Mohammad Abu Rayya. In your experience in public health, do you have any solutions and recommendations on how to ensure that Palestine can be more prepared to respond to future pandemics?
And let me again and again confirm what my colleagues have been said, and especially Mrs. Manar, and I like so much her representation and even saw the last slides, because she reflects what's the most needed during, even so, from Syria or Palestine or Iraq, because we are, as we said, we are sharing the same consequences usually. But I prefer, from my experience, to have a solution, first of all, before the recommendation, especially for Gaza. And first of all, just to make the balance between the health and economic, because we cannot move forward for a long time lockdown, because the people here in Gaza need a daily movement for trying to manage their life by food and water and communication. The situation in Gaza as economic side is very bad and below the international standards. The second is to raise up all the public awareness based on our need and due to the crowds and the high density population in Gaza. The most important now issue to put all the medical and scientific in the top of the pyramid. Now it's the time for the world to know it's the most important issue for the scientific and the medical field and the health worker. We are now facing the pandemic, and this kind of pandemic will not finish during this year or next year. It could be temporarily for the next 3, 4, 5 years until the God will manage it by itself. So the most important issue now is to put all the medical and the scientific in the top of the pyramid and to give the appreciation for them. Now all the world know what's the important for us who is working in this field, who is working in the front line. And the most important, let me confirm it, is not to put the people in the lockdown only. If you want to put the people on the lockdown, you should prepare for them the food, the water, the medication, and the communication. Because in Palestine, particularly in Gaza, the situation, as I said, is so much difficult. So nobody can handle lockdown more than 2 weeks or 2 days. Nowadays, we're having the module of closure for 2 days. We're trying to break down the chain of infection. But in the near future, in case that the vaccine will not be received, it will be more difficult for us in Gaza. So again, the recommendation and the solution, as we said, to put the medical and the scientific in the top of the pyramid and give them the high rank and appreciation, increase the budget of the health inside Palestine, because majority of the cases and majority of our budget have been going through for transfer the cases outside Gaza. So we try to make a localization for this kind of service inside Palestine, which will save a lot of money, develop the human resource, and to use the medical technology, which we can share it and from our international and from our partners. The most important also, the lesson learned and the experience which we can share from our colleagues, as we know we are sharing from Syria, from Iraq, from Malaysia, from other people. So putting all on this in the top of need and trying to focus and to see it in the very clear picture that COVID-19 have been destroyed very big and international health systems. What about our system? It's already facing a fragmentation and facing a crisis like Syria or Iraq or Palestine. So the COVID-19, we should put the priority of not only the casualty, not only the earthquake, to put them for the communicable and non-communicable diseases, to focus on them in the near future, to guide our medical students, to guide our governmental, to focus on this issue, because all the near issues belong to the COVID-19 and other non-communicable or communicable diseases, which we cannot imagine how it will be in start and how it will be finished. As my colleague have been said, still we are in the center of the emergency. We need more equipment. We need more updated for our colleagues and for our students. And let me complete and finish my intervention by the most important, for me at least, to raise up the public health and to tell the people what is the consequences, because without our people we cannot fight, we cannot do it alone to fight the COVID-19. They should know what's the most important: the pyramid 3, governmental, society, and health worker. If we work together in the same main objective and the same aim, we can succeed and we can go through this tunnel to reach for the light, to help all the national and the international community to finish this kind of COVID-19. And finally, and not last, I hope that all of us will survive, and I'm trying to advise all my colleagues to delay the infected for the COVID-19 until we can receive at least the vaccination. We can see more and more lessons learned from them. It is an important issue to share our information and knowledge between us as expertise in this field, and from all this high rank and outstanding groups and people, Dr. Walid, Mrs. Ihlas, Mrs. Marion, all of them, and all the respect for them, and thank you so much.
Right, thank you, Dr. Mohammad Rayya, for the brilliant solutions and recommendations that I think we all can learn from it to apply in our settings. And to end the question in round 2, Dr. Walid, you mentioned previously about the challenges of economic control, where you wanted to care for patients for referral for specialist care. It's hard to get with this current pandemic situation. Can you share with us how do doctors have to go above and beyond in treating their patients? Right, do we have Dr. Walid?
Yes.
Yes.
Okay. Bismillah ar-Rahman ar-Rahim. Again, we are facing challenges, and we are accustomed for these challenges in Gaza. The healthcare system is accustomed for emergencies and the crisis, medical crises. As you know, coronavirus is known since 1960, about 60 years ago. It is not a new virus, but it comes and back, like in 2003 as SARS, and in 2012 as MERS, and finally outbreak in Wuhan in China in December 2019, and now reach Palestine for the first time, COVID-19 on 19 of March 2020. The Palestinian Authority requested citizens to restrict movement at national and regional level following guidelines taken, and certain measures were implemented, like closures of all schools, universities, and public parks, closure of all borders, government quarantines for 14 days, testing for all coming travelers, no movement between governors, and the closure of all stores, public institutions, and other crowded facilities. The situation in Gaza, as you know, is different in comparison to different countries, and the curve now is flattening, epidemiological curve, fortunately. The steps of dealing with coronavirus start with triage, what is called the triage in hospitals and health facilities, to recognize who are suspected cases of coronavirus and to proceed for investigation and management, collection of samples, nasopharyngeal swab for PCR, and isolation for 14 days at least, either in health facility if they are symptomatic and need hospitalization, or at home quarantine. Now, the situation in Gaza as regard the challenges and the management protocol we mentioned is not different as protocols in other countries, but there is Gaza situation is different than other parts of the world. Since the siege on Gaza in 2006, there is continuous lack of medication supplies and equipments in the Ministry of Health and other health sectors. About 45% of essential drugs are lacking, and some periods lower than this figure. And in some time recently, oxygen therapy was also lacking for some period, but not for a long time. And the PCR kits also for COVID-19, sometimes not available, but soon supplied. As you know, the general population in Gaza, about 2 million population, the available ICU beds for corona patients, about 150, and the plan to be 200. This number is not sufficient in comparison to the total population. But fortunately, the ICU beds occupancy rate did not reach 100%. However, we may face big problem if the critical cases increase beyond the ICU capacity. Fortunately, we did not reach 100% occupancy. We are still waiting actually to receive the corona vaccine. The epidemiological situation now shows flattening of the curve, as I said. The total infected cases about 51,000, and the active cases about 4,600, recovered about 46,000, and the total deaths since the start of corona pandemic in Gaza yesterday was 520 cases. So the mortality is much lower than any mortality rate in other countries. MOH has implemented effective measures to ensure early detection and case management of any suspected COVID-19 case, and so far have ensured that quarantine and treatment facilities. MOH developed a new COVID-19 dashboard in Arabic to track cases. A central operation room has been established. Laboratory capacities of the Ministry of Health have been scaled up. The point of entry check for incoming travelers are being conducted, and isolation wards was prepared. Health workers are equipped and trained in an appropriate infection prevention and control measures and case management of a protocol COVID-19 cases. The general public continues to be regularly updated, including advice on how to protect themselves. The drugs available, I think, is not all drugs are available in Gaza, but the basic drugs like hydroxychloroquine, colchicine, vitamin D, C, and zinc to support the immune system, and dexamethasone in the protocol. Colchicine is newly introduced as management protocol beside hydroxychloroquine. They are non-specific, but the trials shows improvement in the cases. But now I would like to summarize my talk in both sessions. The Ministry of Health strategy to end the COVID-19 pandemic were to stop the transmission of COVID-19 across the patient and to reduce the demand for hospital critical care services and to avoid any overload of hospital care capacity. To provide adequate care for patients affected by COVID-19 and to support their families and the close contacts and minimize the impact on the epidemic on the functional capacity of the health system. The Palestinian Authority strategy guidelines and the protocols and the plan against COVID-19 were similar to other countries having disease, including isolation, maintain social distance, but Palestine has different challenges and limitations in the treatment and management of the disease. The pandemic by COVID-19 is a dangerous issue affecting people worldwide, and still this pandemic is ongoing and no suitable treatment until now except effective vaccine. Supportive treatment is still the main strategy in treating this disease, and no active curative antiviral has been approved due to lack of evidence and precise information. Finally, isolation of patient and other preventive and precautions are now the most important way in reducing outbreak of this virus, and these prevent transmission of the virus. The frequent wars on Gaza by Israel makes doctors of Gaza to gain great experience to work in difficult and emergency situation. Thank you very much.
Thank you, Dr. Walid. That's very fruitful for you to explain the measures you've taken. And with that response, we reach the end of our round 2. And before we go to the question and answer session, I would like to introduce to you a special person, Mohammad Sayam, Vice President of the International Federation of Medical Students Association of Gaza, to share with us a youth-led initiative that medical students play in Gaza in terms of sharing information regarding COVID-19. Please welcome.
Okay, thank you so much for the introduction. Can I share my screen or not? Yes, okay, I can. Okay. Okay, first of all, thank you for Hospital Beyond Boundaries for this collaboration. Thank you for the webinar, and thank you to everybody who attended. And thank you for the speakers on their talks and answers on questions. And of course, special thanks to Dr. Mohammad and Dr. Walid Daoud from the Gaza Strip. The International Federation of Medical Students Association Gaza is a local committee of the IFMSA that works here in the Gaza Strip. Of course, we're the only branch in the Gaza Strip who implement those activities. My name is Mohammad Sayam, and I'm the Vice President for External Affairs in IFMSA Gaza. A small overview about us is that we're an independent, non-governmental, and non-political federation of medical students, that we're not affiliated with any social political activities, non-profit organization, as I mentioned, that is established mainly to serve medical students, engaged with them, of course, and educate them to serve the communities we live in, of course. IFMSA was founded in 1951, and we have worldwide, of course, 136 national member organization in 126 countries over 6 continents, with a mission to unite medical students from all around the world with, of course, to lead initiative that impacts our communities positively and represent our opinions. As medical students, we are the future health professionals in the field of the global health. And of course, we try as much as we can to work with external partners locally, regionally, and globally, of course, to build capacities and train medical students, get projects and events, and of course exchange opportunities for the medical students to know more about the world, or the healthcare systems around the world, and of course embrace cultural diversity. And this is our vision, that we want to unite for a global health, of course equip knowledge, skills and values on health leadership, of course roles locally and globally, with main objectives, of course, to expose medical students to the humanitarian and global health issues, as we believe the local implementation roles for the global health priorities and the UN Sustainable Developmental Goals. And we try as much as we can to provide the students with opportunities to educate themselves, to facilitate partners between the medical student community as we are and local NGOs and of course global NGOs, and this helps the students to prepare themselves for the postgraduate life. To give medical students the opportunity to take part in exchanges and of course research exchanges around the world, and provide a network that links the active medical students across the whole globe, including of course leaders, managers and activists for the goal that we work on. We provide an international framework for the medical students to work on and focus on during their years of studying. So as I mentioned, to prepare them and engage them more in the communities, to raise awareness and of course get trainings. We started locally here in Ifmsa Gaza in 2006, and right now we're more than 700 full members, and to get those full members are not including the first year medical students. So we're going to talk about the whole Faculty of Medicine. We're talking about 1,000 members with constitutions and bylaws that we follow from the International Federation, and 16 members as the team of officials that are elected every single year. And we work mainly focusing on 6 standing committees. We work to serve the standing committees and that are medical education, professional exchange, public health, and sexual and reproductive health and rights, including HIV and AIDS, the research exchange, and the human rights and peace committees that we work on to, as I mentioned, to train medical students to get projects and get to the public regarding this. So we work with a lot of, as I mentioned, we work with a lot of external partners as the WHO, the Ministry of Health, the Palestinian Red Crescent Society, the University, Al-Azhar University, the UNFPA, the PCRF, the Palestinian Medical Relief Society, and other, of course, a lot of other organizations and associations locally and globally to implement our thoughts and our goals to educate medical students, and as I mentioned, all the objectives before. So we do a lot of things, and of those things come from basics, first aid and basic life support trainings, to cultural visits to a lot of places around the Gaza Strip to know more about our culture and be able to get or give informations whenever we exchange around the world. We talk to a lot of people worldwide via portals and webinars. We go to the society and we raise awareness, of course, with a lot of our partners. Those photos presented to you right now are photos taken on the World Health Day in 2019. The campaign was the Universal Health Coverage campaign, and we tried with all of our partners, of course, to raise awareness and talk to the community on the universal health coverage, as well as photos taken from a lot of other activities. Those are from the Pink October campaigns that we always focus on to raise awareness on breast cancer. We work as well, of course, especially lately, the last year with the COVID-19 problem and crisis worldwide, to implement a lot of activities online. We teach medical students and train them on research trainings, human rights trainings. We go to the society, as I mentioned. Those photos were taken from an activity we've done with the Right to Live Association that is for children with Down syndrome. So the moral of the story that we do or did everything regarding our fields, and you can find us on Facebook, Instagram, and Twitter, as mentioned in the slide here. when the COVID-19 crisis hit the world, we tried as much as we can to serve the community, as I mentioned, because we're part of the community and we take some of the responsibility as medical students and as part of the community. So in collaboration with our university, and before the COVID virus hit the Gaza Strip, this was all before any cases were found in the Gaza Strip, we went to the community, to the public places as the malls, the beach, the cafes, a lot of places to raise awareness and talk to the community about the COVID-19 virus and educate them more on what is coming. And we stopped immediately when the risk was uplifting a little bit, and as we didn't want anybody to get in risk to get the COVID virus. So we started to work more online. We provided the internet with 3 videos regarding the COVID vaccine, talking about the COVID, frequently asked questions, and a special video for people with special conditions as hypertension and diabetes. And 2 months ago, we created a COVID-19 response team that worked especially online of course, to raise awareness and talk to the community. We partnered with the Ministry of Health on every information that we provide. And we organized sessions and webinars on COVID-19 for medical students, talking to a lot of doctors and professors worldwide. We did post a lot of photos and a lot of infographics regarding the vaccine and how to live the normal life during lockdown and what to do. And of course, lately, when the vaccines were out, we tried to be one of the first people in the Arab region to educate the people and the public about the vaccines and what is going on around the world. So we tried to post a lot of posts regarding this. Of course, the COVID-19 crisis hit us very hard as medical students, as mentioned, of course, by Dr. Mohammad and Dr. Walid. This postponed our medical rotations, our exams, our bedsides, and trainings in the hospitals. And this was very hard to resume to our education when the COVID-19 was hitting the Gaza Strip, until very lately when a lot of protocols were founded for medical students to get back to the hospitals and to the trainings. So I believe that what we're expecting now, as mentioned by the speakers, is better outcomes from all of this, and of course, vaccination for medical students, maybe especially the medical interns and 6th-year medical students, as they are part of the frontliners when it comes to the COVID-19 cases, and especially in the Gaza Strip right now.
Right.
I want to make it so long, so thank you very much. This is all for me.
Right, thank you, Mr. Mohammad Sayam. That's a very meaningful initiative, perhaps a proactive approach from you and the team. And for those just joining us, welcome to the webinar. But we are coming into the question and answer session, so don't worry. This is recorded, so you can get and view it later on the Hospital Beyond Boundaries website and also on the social media platform. So look us up there. And we have a few questions for our speakers. And I would like to direct my first question to Dr. Ihlas. And you mentioned about the impact of the pandemic on the sexual and reproductive health of the community. And can you share briefly any projects being carried out or planned to address this impact?
Yes, absolutely. So basically, I mean, working for CARE, where I'm, as I told you, supporting some health facility inside Syria with all, I mean, the supplies, the salaries, the running costs, and so on, to provide sexual and reproductive health services. But because, adolescents are making, let's say, a big part of the community and the vulnerable groups that need our intervention, need our support. I would like to mention here very briefly about the, let's say, an initiative that we are implementing inside Syria. It's called the Amman Initiative. And as you know, Amman in Arabic means hope. and it stands for Adolescent Mothers Against All Odds, where basically there's a curriculum that was created in partnership between Care International, UNFPA, and a Syrian local organization, where adolescent girls are enrolled in 8 sessions during 2 months, where they are receiving, you know, basic sexual and reproductive healthcare information, of course, according to their level of education, because they are children between, you know, 11, 12, and 19 years old. They should be married with or without children. And in addition to the sexual and reproductive health information we are providing to them, there's some basic life skills, and the scope is to enable those children to deal with their own children they have, with family, with the health providers, because at the beginning the component or the curriculum was targeting only adolescents. Then we saw that we cannot only deal with the adolescents without taking the entourage of the adolescents. So the initial curriculum was called Young Mothers Club, and after almost 1.5 to 2 years, it was, let's say, revised, and it's called now the Amman Initiative, and it includes 3 components: the Young Mother Club targeting the adolescents, in addition to 2 other components. One is targeting the community members, and this includes imams, principals of schools, or any other person who is interested in the health and well-being of adolescents, and healthcare providers, because healthcare providers specifically can play a very positive or negative, role while providing health services to adolescents. I can give you an example. For example, Yani, if it's the culture in Syria that immediately after marriage you should, as a female, to have your own child. If any contraception method is used, then I will never be able to make children afterwards. Or, I don't know, IUDs cannot be used, and so on. So working on those misconceptions with healthcare providers played a major role, in easing the service provision to adolescents, made their life easier. And of course, the final scope is to make those children able to be other children and move on with their life.
Right.
When they are already married, and we cannot change that, at least to give them some skills, some information, so they can manage their lives.
I see. So thank you, Dr. Ihlas. Such a wonderful educational intervention to various stakeholders. Right, and my second question, I would like to ask Ms. Manar. We got a question from Nisa from UPM, University Putra Malaysia, about how can the mathematical modeling you mentioned earlier can assist in handling COVID-19?
Yeah, so I think there are different ways like that it can assist. As I mentioned a little bit, first, with support for policymakers, so they will be able to weigh the cons and pros for interventions and see whether they want to make the decisions, so providing them with evidence on different interventions like school closure, hand washing, face masks, etc. And then the other thing now, I think that I saw also other question is about the vaccination. So the mathematical modeling now, it's important to help to see which priority groups, especially in limited income settings. So at the moment we understood that there will be maybe only 20% of the overall population will be able to support it with vaccine in the third quarter or fourth quarter in Syria. This is in optimistic scenarios. And then it's important to see we see which groups will be more impacted, or which age groups will have better impact if they're vaccinated first. So I think there are different ways, I would say, that it can support. Yeah. So I think it depends, but I think the most important is like the close collaboration with policymakers and then people on the ground. This is what makes a difference, I would say, into the results, because there are lots of models around the world, but I think the most important is communication, collaboration.
Right, thank you, Ms. Manar. My next question would go to Dr. Mohammad Rayya. We've got a question about it's hard to get vaccine accessible for middle and low income countries. Then if that's the case, how can we play a role to break the chain of COVID-19?
Can you repeat the question, please?
So we've known that it is hard to get the vaccine for middle and low income countries. So if that's the case, how do we play a role to break this chain of COVID-19?
And we still optimistic that the WHO and the COVAX who have been created to support the third people like us and the low economic by supporting them by vaccine, we still are waiting, and we're still optimistic that we can receive at least the minimum amount of vaccination. But on the other hand, in case that we need more time, we should also focus on the public to raise up the public awareness, to tell them again and again the matter of the consequences and the bad complication of the COVID-19. And now we called it COVID syndrome, because a lot of complications have been raised up due to after 1 year now from the COVID have been experienced. So I think for our situation, especially particularly in Gaza, the public awareness is the most important issue to handle the people until we can, hopefully we can receive the vaccine, with either than the Russian one, either than the American one. We don't know, but a lot of efforts have been done from the Minister of Health in the West Bank and even in Gaza. Again and again, I think is the most important issue is the community and the commitment and to follow the rules of mask, social distance, and not going for the crowded places. And the most important, again and again, to keep yourself away from all the crowded places. I think it's the most important issue for us.
Right, thank you, Dr. Mohammad Rayya. Thank you. And last but not least, the question for Dr. Walid from Sarah from Uni 10, which is one of the university in Malaysia. Again, and another audience has asked something similar, is that some countries are implementing home quarantine for confirmed COVID-19 cases. Is this safe for the patient's family? And what other low-cost protective measures can the family do at home to keep themselves safe?
I think to cut the chain of transmission of COVID-19 is isolation or quarantine, and this is very important because the virus spread depends on contact and communication with the people. So quarantine is very important to prevent spread of the virus and decrease the incidence of COVID-19 infection. And now it is the easiest and simplest method if need cooperation of the population to implement quarantine properly. Now, quarantine at home may be not 100% preventive, because quarantine at home, contact is not 100% is prevented, but may be effective if the members of the family implement quarantine properly. But isolation in health facility is much better. But the capacity of the health system is the thing that cannot allow isolation of all infected people, I think. This depends on the capacity of the health system. Okay, your comment, please.
Can I add one thing, Mohammad, for this, please?
Yeah, sure. Please, Dr. Mohammad.
Yeah, based with our colleague, Dr. Walid, have been saying maybe in Gaza we have a good experience because of the crowdness and the density population, and we have a success stories for the home isolation. I totally agree with him that so many cases need to be isolated in the hospital, but majority of them based on the that we call it teams of NGOs and the local NGOs, international, are working in this issue just to support and to help the Minister of Health in the lack of beds and lack of occupancies inside it. So majority of them, they are supporting them at home by regular visit, by supplying them with medication like zinc, vitamin C, vitamin D, azithromycin, and even so for oxygen in case that they need it. And usually we are advising all the people inside the home, in case that you're feeling that your situation has been deteriorated and having some respiratory disorder like dyspnea, or you need some need for hospital, just call 103 and they will transfer you to the hospital. But based on our situation in Gaza, the most important issue nowadays is the home isolation, because as Dr. Walid
what we have, Dr. Muhammad,
yes,
that's
sir.
what we have. This is the situation. Despite
yes.
the bad economic situation and the low financial facilities, but I think our people now gain experience, and they, to a big extent, they implement isolation because the public awareness about the problem is raised actually in all people, and I think isolation at home is the optimal thing in case of increased number of cases beyond the capacity of the health system, with supervision and
totally agree.
Support of the health system in all at all levels.
Right.
Totally agree, sir. Totally agree.
Dr. Mohammad and Dr. Walid. So basically, if you have reached the system have reached some limit, then you should think about home isolation as an option, but not the ideal solution for the curbing the spread of COVID-19. Right. So with that question, that's the end of our question and answer session. Unfortunately, we don't have time to address all questions, and I believe we've got so many questions coming in from all over the place, from India, Pakistan, and apologies for to those who ask questions. Thank you so much for your active participation. And on that note, I would like to once again thank you, all the speakers, for your participation today. You've shared so much insights and different views and perspective, ideas with us. I really appreciate that time and the effort that you've taken to join us. Special thanks also to the School of Health Sciences, University of Science Malaysia Health Campus, for agreeing to provide their facility for me to moderate this event. So thank you for that. And definitely not to forget, thank you for our lovely audiences who've been with us since the beginning, asked questions and very attentive. Thank you for your acceptance to our invitation. And a bit of a gentle reminder, after we've ended this webinar, you will receive an email containing a Google Form survey. Please fill in the form and submit it for you to receive your e-certificate. And in that Google Form as well, we have a section for you to fill in suggestion on what topic you want to see being discussed in the next webinar. I have been told by the committees of Hospital Beyond Boundaries, they are organizing similar initiatives in the future. So please keep an eye out for those announcements on all Hospital Beyond Boundaries platforms. It does not end here. I believe they are planning for another international webinar on youth. So keep posted. Follow us on Facebook, Instagram, and Twitter, and also share with your friends. Again, thank you for joining us. Apologies to the speakers if any interruptions have caused any ill feeling. I take all responsibilities for that. So with that said, thank you so much. See you next time.